As many as 1.6 billion of the world's 2 billion informal economy workers are affected by lockdown and containment measures. These include workers in accommodation, food services, manufacturing, wholesale, and retail, and the more than 500 million farmers producing for the urban market. The International Labour Organization report says women are particularly affected in high-risk sectors. COVID-19 containment measures in many countries cannot be implemented successfully. This is endangering government's efforts to protect the population and fight the pandemic. The report says this may become a source of social tension in countries with large informal economies, with most informal workers having no other means of support. They face an almost unsolvable dilemma: to die from hunger or from the virus. This has been exacerbated by disruption in food supplies, which has particularly affected those in the informal economy. For the world's 67 million domestic workers, 75% of whom are informal workers, unemployment has become as threatening as the virus itself. Many have not been able to work, whether at the request of their employees or in compliance with the lockdowns. Those who do continue to go to work face a high risk of contagion, taking care of families in private households.
The ILO estimates that 1.6 billion informal workers are affected by the pandemic, and they face a dilemma of choosing between dying from hunger and dying from the disease. Informal enterprises face similar challenges. As these workers and enterprises are not registered, they cannot benefit from government support. The ILO therefore proposes 4 measures. Firstly, to reduce the exposure to the disease. Secondly, to provide access to healthcare. Thirdly, to provide income and food support. And lastly, to preserve jobs and keep businesses afloat. And all of this underlined with social dialogue.
Informal economy workers significantly impacted by lockdown varies from 89% in Latin America and the Arab states to 83% in Africa, 73% in Asia and the Pacific, and 64% in Europe and Central Asia. Among its recommendations, the report highlights the need for policies that reduce the exposure of informal workers to the virus, ensure that those infected have access to healthcare, provide income and food support to individuals and their families, and prevent damage to the economic fabric of countries.